Please go ahead.
Okay, sir. Okay. A very good afternoon and a warm welcome to one and all present here in this planet session. Today, we are going to cover the very important topic, which is erectile dysfunction. And we have our speaker doctor, who is none other than Dr. C. Sharath Kumar, sir, who is going to cover this topic. So, without much delay, let me take this opportunity to welcome our speaker, Dr. C. Sharath Kumar, sir. Sir is super specialist in sexology and infertility, director of Mediwave IVF and fertility research. So now, without much delay, I would like to hand over the session to you, sir, for your talk. Over to you.
Good afternoon, colleagues. I am Dr. C. Sharath Kumar, super specialist in sexology and infertility. I am the director of Mediwave IVF Hospital, Mysore, and also I practice at Bangalore, that is in Dr. Sharath Men's Clinic, Bangalore. I practice sexology as well as infertility. Welcome to this afternoon session of ClearNet. The ClearNet people have asked me to talk about the erectile dysfunction. I thank the ClearNet authorities for giving me an opportunity to speak to you, friends. Friends, everybody knows what the infertility is. So these are my just qualifications for your information. And today I'm going to talk on the management of erectile dysfunction, the understanding the modalities and the management of erectile dysfunction. So just to define what erectile dysfunction is, the recurrent inability to achieve an erection is called as erectile dysfunction. The inability once in a way it can happen to anybody, but if it is recurrent inability, then we classify it as erectile dysfunction. And inability to maintain an adequate erection during intercourse is also called as erectile dysfunction. So there could be erection, but it may not be adequate to maintain the erection towards throughout the intercourse. That also comes under the classification of erectile dysfunction. And noticeable decrease in erectile rigidity is also called as erectile dysfunction. So to label one person as having erectile dysfunction, it should be recurrent, that is continuously. Once in a way, if there is a loss of erection, it cannot be classified as erectile dysfunction. So the criteria for labeling a person as erectile dysfunction, the partner factor, before any diagnosis of ED is made, the following factors must be considered. The partner factor, whether the erectile dysfunction is with a particular partner or with all the partner. Then relationship partner, communication problem, different level desire, sexual activity, partner violence should be taken into consideration. Individual vulnerability, history of sexual emotional existing psychiatric conditions such as depression and stressors, loss, that also should be taken into consideration. And cultural factors and medical factors. Medical factors of any known disease should be taken into consideration, especially the conditions of cardiovascular conditions. So causes of erectile dysfunction. What are the main causes of ED? Cardiovascular cause is the first and foremost cause for erectile dysfunction. The second foremost is diabetes. The third one is other medicinal products. Fourth is any surgery of the prostate or of the urinary bladder, neurological conditions, and endocrinopathies, endocrine problems, that is hormonal problems. So these are the main factors that cause the erectile dysfunction. These are known causes. There are, of course, unknown causes also, but what I have listed is the known causes. Now coming to cardiovascular disease. Why the cardiovascular diseases cause erectile dysfunction? The most important cause for erectile dysfunction is the dyslipidemia, tobacco intake, hypogonadism, diabetes, hypertension, vasoconstrictor diseases, increased autonomic disorders. So these are all the cardiovascular causes, and they cause endothelial injury. And endothelial injury, as you know, causes the penile artery to undergo the damage. Once the penile artery is damaged, then there will be erectile dysfunction. What are the risk factors for ED? There are so many risk factors for erectile dysfunction, which cause as predisposing factors. Aging. As the age advances, a person can get the erectile dysfunction. The next one is chronic illness. Any chronic illness, especially heart disease, hypertension, diabetes mellitus, peripheral vascular disease, they may cause the erectile dysfunction. These are predisposing factors. Smoking is one of the worst factor which affects the erectile dysfunction. Erection decreases in a person who smokes a large number of cigarettes per day. Alcohol misuse, obesity, lack of physical activity, depression, and elevated cholesterol. These are some of the risk factors of a person to get the erectile dysfunction. In other words, a healthy person getting erectile dysfunction is lesser than an unhealthy person who has got large number of diseases like heart disease, kidney disease, liver disease, and other diseases. And also, the risk factors increase as the aging advances. So, psychogenic erectile dysfunction. So, performance anxiety, relationship problem, interpersonal relationship problem, problem with intimacy, depression, guilt, previous sexual abuse, and psychological trauma. These may cause anxiety, and the anxiety is one of the worst factor for the erection. So, erectile dysfunction occurs in all these psychological causes. Vasculogenic or arterial cause, that is atherosclerosis, hypertension, trauma, these are all some of the causes for the erectile dysfunction. Neurological causes, stroke, Alzheimer's disease, spinal cord injury, radical pelvic surgery, diabetic neuropathy, pelvic injury, all these causes penile nerve damage. Once the penile nerve is damaged, there will be erectile dysfunction. Hormonal causes, hypogonadism, hyperprolactinemia, these are known causes for erectile dysfunction. Drugs, many drugs cause erectile dysfunction, especially antihypertensive drugs, antidepressant drugs, anti-androgens, alcohol abuse, cigarette smoking, they cause erectile dysfunction. So how to diagnose erectile dysfunction? History, examination, and investigations. I'm not going to the minute details of all these things because all of you know how to take the history, what are the examinations to be done, physical examination, and then of course, if necessary, color Doppler penis, and what are the drugs to be used. Now let me come to the treatment aspect of erectile dysfunction. The most important factor of the management of erectile dysfunction is the general measures. Smoking must be stopped, reduce alcohol intake, if one is obese, weight loss, and good exercise, continuous exercise is very, very important. So nutritional supplements, what are the nutritional supplements which help in erectile dysfunction? L-arginine intake, L-citrulline, propionyl carnitine, flavonoids, zinc, selenium, vitamin D, folic acid, methylfolate, DHEA, ginkgo, ginseng, and ashwagandha. All these nutrition supplements help the one to combat erectile dysfunction. Psychosexual therapy. Most important is psychological counseling is very, very important. Even if causes of ED is physical, the patient will develop psychological issue, performance anxiety. In these cases, sensate focus therapy and counseling, they will help to combat the erectile dysfunction. What are the drugs which are useful in the treatment of erectile dysfunction? Oral agents, phosphodiesterase type 5 inhibitors, oral phentolamine, apomorphine, yohimbine, intracavernosal drugs like prostaglandin, alprostadil, papaverine, intraurethral drugs like alprostadil, they help to treat the erectile dysfunction. So oral therapy, you know very well, apomorphine, sublingual tablets are available, yohimbine tablets are available. These two help to overcome the erectile dysfunction. Androgens, testosterone level, you know, is very, very important. If the testosterone level is low, giving testosterone in the form of injection will help a person to get rid of the erectile dysfunction. So role of the TRT, that is testosterone replacement therapy, is very, very important. So intracavernosal injection, if the oral medicines, that is alprostadil or other drugs, if they don't work, then we have to go for intracavernosal injection like alprostadil or The alprostadil can be given in the dose of 5 to 40 mg local injection directly to the penis. It is independent of intact nervous system. It manual dexterity, adequate vision training is very, very important. It is contraindicated in bleeding disorders, sickle cell anemia, multiple myeloma, leukemia. The side effects are, penoscrotal pain, hematoma, fibrosis at the time of the site of injection, and priapism. The intracavernosal injections available are papaverine, phentolamine, and alprostadil. This is intrarectal alprostadil. So, most important thing is lifestyle modification, and the risk factor should be used. When a curable erectile dysfunction cause is found out, treat the cause. If it is not curable, then inadequate, incorrect prescription and poor patient education are the main causes of failure of lack of PDE5 inhibitors. I didn't go to the details of PDE5 inhibitors. You know very well the PDE5 inhibitors are available in the form of the sildenafil citrate and tadalafil, avanafil, udinafil. And if these things fail, then we may have to go for penile implant surgery. So friends, thank you for your attention. In the next video, I will tell you more about the drugs availability, indications, contraindications, dosage of PDE5 inhibitors and other drugs available for the treatment of erectile dysfunction. So thank you very much for your attention. And also I thank the ClearNet authorities for giving me an opportunity to address my esteemed colleagues. Thank you.
Thank you, sir. Thank you so much for sharing your valuable knowledge with us. And now I would request all the doctors present here to share your views on this. You can write down all your questions to us on the live session page. There is an option post your queries here or comments here. You can use that option to share any queries, any views, any comments with us. So request all the doctors to please share your views with us by writing it down.
So thank you.
Yeah, sir, just give us.
Yeah, any questions? I am ready to answer.
Sure, sir, just give me a minute. Let me check. Dr. Borges wants to know, comment on psychological aspect of EDF.
Psychological factor plays a major role in the erectile dysfunction. In fact, 40% of the causes of erectile dysfunction are from psychological factors only. So they have to be addressed properly. And the best thing is to do the counseling with a partner to find out the real cause for the erectile dysfunction. Whether it is where the psychological factor is due to the partner or due to the environmental factor or due to any other stress-related factors. So counseling and questioning and answering all the questionnaire will really find out and rule out the psychological factors.
Okay, sir. Thank you. Thank you so much. And we have already crossed the time limit also. So this is the last announcement to all the doctors. Any other query from your end, if you would like to share with us, please write it down, or else we are going to close the session here for today.
Thank you.
So for today, sir, we don't have any other queries. We'll collect the feedback. So that time, sir,
let it be sent to my email. I'll answer them.
Sure, sir. Sure.
Oh, yes. Thank you.
Thank you so much.
Okay, bye. Thank you.
Bye, sir. Take care. And thanks to all the doctors for joining in this session. Please stay tuned with ClearNet for such more amazing session. Thank you all.